Hello, I'm Joan Justice with HealthWorks Collective, and I'm speaking today with Dr. Stephen Schimpff, retired CEO of the University of Maryland Medical Center and the former COO of the University Maryland Medical System. Dr. Schimpff is the author of two books on healthcare, and the latest is The Future of Healthcare Delivery. Steve has some definite views on how to curb healthcare costs and maintain a high quality of care, and these relate to chronic disease, and that constitutes a huge percent of our healthcare costs. So Steve, go ahead and tell us your thoughts.
All right, well, thank you very much, Joan. I guess we should start with why are healthcare costs rising so much? We all know they are, and we hear lots of different reasons. I'm going to say that there are two prime reasons, and or factors that affect it, and they are an aging population. You know, at least I know I'm getting older. And
that's me too.
And the second thing, though, is that we have, as a society, a lot of, well, let's call them adverse behaviors. I hate to call them bad behaviors, but just adverse behaviors. And you know, there's four biggies. That's we overeat, and of course we don't eat a really good, nutritious diet. Second thing is we get too little exercise. It seems like everybody's chronically stressed, and unfortunately 20% of people still do smoke. So you take those four, and there are others, but those are the biggies, and they are just driving literally epidemics of chronic diseases. And we're going to see this more and more. I mean, we know that a third of the population is overweight. Another third is actually, frankly, obese. So you take obesity, you take high blood pressure, and these are then driving other diseases, diabetes, for example, heart disease, strokes, cancers, chronic lung disease. And when you look and ask insurance executives, you know, where do you spend your money? They say that of all our claims paid, 70–85% go to taking care of these chronic illnesses.
Right.
So it's a real problem. Now, here's where I get at the issue of why the costs are going up. This kind of patient who has one or more chronic illness needs to be treated not by a doc, a nurse, but by a whole team. Let's take the diabetic patient. Maybe over time, an endocrinologist, maybe a podiatrist, an exercise physiologist, a nutritionist, an ophthalmologist, maybe at some point the cardiologist, vascular surgeon. So it's a huge team, but any team needs a quarterback, somebody to coordinate that care. My own belief is that is ideally your personal primary care physician. By the way, I'm not a primary care physician, and was not, but I do believe that they're sort of the backbone of our system. So we need care coordination for those with chronic illness, and of course we need much more prevention to prevent these chronic illnesses from occurring, and that's obviously easier said than done. But you know, why are these illnesses so important to us? Well, I think there's three key things. Once you develop one of these, it's with you for life. Diabetes, for example. Once you have it, you're going to have it all the way to the very end. Now, certainly some cancers we can cure, but chronic lung disease stays with you, heart disease stays with you. So these are illnesses that once you have them, you keep them. Second thing is they are difficult to manage. And the third thing is, because they're going to be with you for a long time, they're hard to manage, they're expensive. But they're much more expensive than they need to be, which is, I guess, where I want to go with this. There's an institute called the Milken Institute. I hope I'm pronouncing it right. They did a comprehensive study of chronic illnesses a couple of years ago, and what they found was that there's about 109 million Americans with at least one chronic illness. And they project, and I don't remember all their details of that this is going up at a rapid rate. And again, it gets back to our discussion of adverse behaviors. So the costs are high. They estimated $275 billion a year in direct medical costs and $1 trillion in lost productivity from work and everything else. So a lot of money. Just look at Medicare for a second. 85% of Medicare enrollees have at least one chronic illness, and 50% have three or more. So they're common. They're common, and it's not medicine over the last century or so is really focused. It's just grown up around acute illnesses. Let me define that a little bit. If somebody gets a pneumonia, you see a doctor, you get an antibiotic. If you develop appendicitis, you see a surgeon, get it cut out. Either way, when it's done, it's done. Chronic illness, that diabetes, again, it's with you, maybe an acute episode, but the whole thing is still with you for a long time. Now, big issue. It looks like I'm going to take a diversion, but it'll come back quickly to my point. And that is, if the primary care doc is the one who ought to be coordinating the care of these patients and helping with the prevention side, they're not doing it right now. And that's kind of, I don't mean that as a harsh critical statement. Here's the reason. They're in a non-sustainable business model. Their costs have been going up. Office costs go up, insurance goes up, everything goes up, but reimbursements have been flat. Right. And this is the old story, if your income is flat and your costs go up, you try and make it up in volume.
Volume, sure.
So they do two things. One is that I'm not going to go to the hospital and see patients in the hospital anymore. Fortunately, we have hospitalists now to kind of backstop that. And they say, I'm going to see patients for a shorter period of time. I can see more patients in a day. So that's the infamous 12 to 15 minute visit that too many patients get. Now, if you have a couple of chronic illnesses and you're on 6 or 7 medications and you come into the doctor's office, 12 minutes is not a good thing. Yeah. It's not enough time to really give what I call good care coordination. So, what do we have to do to lower the costs? We have to deal with our behaviors, and we have to deal with aging. Now, we're all going to keep getting older, unfortunately. We can't stop that. But we can slow it down, and we can slow it down just the same as we can deal with the behavior issue. It's the same 4 things: nutrition and diet, exercise, stress, and smoking. And it's just well shown now, and just take osteoporosis, for example. You can slow that progress if you exercise on a regular basis and eat a good diet. So prevention, we can deal with that. Now, what about care? And we need incentives. We need incentives to do the
motivation, sure.
And sometimes, money will work as an incentive. So, for example, if we're employed, our employer can offer us wellness programs. And in return for us participating, we get a cut in our healthcare insurance. So that's one, at least, a monetary incentive. So let's get on to the care coordination issue. I'll give you a quick example of a friend of mine who lives about 400 miles from where I am, and he called and said, Steve, I am on 23 different medications, and that just blew my mind, 23 medications. And he said, I don't feel good, and very confusing. Some of them are multiple times a day, and I can't afford them. I'm well past Medicare, I'm into the donut hole thing. So I said, well, look, I can't be your doctor at 400 miles, but send me the list, and I'll go through them with you. And I won't go through that whole list, of course, but he's on 3 medicines for his high blood pressure, and really high doses. So I asked him about that, and he said, every time I go to one of my doctors, they check my blood pressure and they adjust my medicines. The key was in the plural word there, doctors. I said, how many doctors do you have? He said, 4. Yeah. I said, do they all deal with your blood pressure? Oh, he said, yeah. He said, you go to the doctor's office, they check your blood pressure. I said, well, do they talk to each other? Well,
no coordination.
No. Right. Do they send letters back and forth? He said, I think so. Electronic medical record? No. Yeah. So I helped him find a single primary care doc, and within 3 months he called back and said he was now on 7 medicines from 23. But it shows the value of that care coordination, and that's just one example. So what can be done? In the end, you got to fix that primary care physician's business model somehow. So they see a lot of patients. Many will see 1,500, 2,000 patients. That's their panel of patients, even more. If you got a lot of patients with chronic illnesses, that number should come way down. My personal belief, it should be down around 500 or so. So number one is care for fewer patients. But if you're going to do that, you got to get paid more per patient. And that means, which is unlikely, that Medicare and commercial insurance will do that, but it would be appropriate, I think. Second thing, everybody's talking about now, accountable care organizations, a capitation type system. that will take care of it, because then you have the time, presumably, and you know the dollars are there. The third thing is to just say, and many are doing this now, is saying, not going to take insurance anymore. You start with Medicare, but you know it can be commercial as well. And they say, just I'm going to charge you what I think is a reasonable fee, just like your lawyer would, your tax accountant would, whatever. And by the way, that makes you the customer of the physician again, because today the customer of the physician is the insurance company who decides everything. So anyway, so number 3 is just don't take insurance and charge an appropriate fee, and hopefully then cut back on the number of patients so you have time. And then the 4th one is this retainer-based concept where the doc says, I'll reduce my practice to 500 patients. I'm going to charge you a fee of $1,500 to $2,000 a year, but in return for that, you can come in today or tomorrow for a visit, give you as much time as you need. Here's my personal cell phone number. Here's my email address, and so on.
The concierge model.
I prefer retainer-based, but concierge is fine. And this gives you much better care. Now, there's a but, and the but is, hey, I got to pay you $1,500, so I didn't have to pay before. So I still need my insurance for everything else. So it's not so simple. But in any event, my quick summary for you would be this: these 3 approaches, or 4 approaches, some combination of them, I think will be the future of primary care. And if instead of today's this volume-based thing, if we can get past that, we can get good good preventive care, so that we prevent chronic illnesses. And the second thing is then, for those who have chronic illnesses, good coordination of that care. Combination will bring costs down really dramatically. The prevention takes time before the cost benefit occurs, but the care coordination brings the cost down really fast. This is my example of the 22 drugs or 23 drugs down to 7. Medicare and the patient, both, or Medicare private insurer, Part D insurer, and the patient both saved a ton of money. So that's my thought about chronic illnesses and what we have to do to bring down costs.
Great information, Steve. Yeah, reducing the chronic disease is a huge challenge now and in the future as we go forward. And we all need to be aware of this and move to help deal with this really important healthcare issue. And thanks so much for the interview and the thoughts. Okay.
Thanks very much, Jen.
Thanks.